So as the Delta variant of COVID-19 spreads wildly across the country, the number of children getting COVID is once again hitting record levels.
That's right. That has the American Academy of Pediatrics calling for the Food and Drug Administration to fast-track approval of a vaccine for children, even while warning against using the approved vaccine off-label for children under the age of 12. Joining us this morning, the chair of the New York chapter of the American Academy of Pediatrics and doctor at Coney Island Hospital, Dr. Warren Seigel. Doctor, thanks for being with us.
Good morning. Thank you so much for inviting me again.
It is a precarious situation because we just can't protect children with vaccines, so we're left to sort of mask and try to keep social distance and all those imperfect solutions. So now they're asking basically to sort of fast track this. Explain to us exactly how that would work and the criteria for final approval of a vaccine for younger children.
Well, we're very concerned. This is not like the beginning of the COVID pandemic a year and a half ago. We are seeing more and more children affected by COVID. To date, about 4.6 million children have been infected. There's been a 22% increase in the past week. We're seeing more and more children in hospitals and on ventilators. So what we're asking is that the same speed in which we were able as a country to get vaccines out to those people 16 and up, and then 12, and now 12 and up, that same speed needs to be used for those children 5 to 12, or maybe even younger.
And you're saying that maybe this could possibly come, and we're hearing reports that it possibly may come in the fall. Is that what you're hearing as well?
We certainly hope so. The faster, the better, as long as it's safe. So remember, the vaccine is safe for 12 and up. We've established that. There are millions of people who've gotten their vaccines, still plenty of people who need to get their vaccines. What we want to make sure is that the dose is safe for a 5-year-old, for an 8-year-old. Obviously can't be just the same as an adult.
Right, so that's the thing. You know, you don't want doctors sort of eyeballing you doing off-the-label uses for the vaccine, trying to figure out, oh, maybe this is the kid's dose, this is smaller. You know, I'm curious. It's such a precarious situation where because there are real concerns about vaccination, and then there are all sorts of crazy things people see online. I'm curious, as a health professional, what percentage of each of those do you see? Is it like 20% real questions, 80% crazy things? What are you seeing in your day-to-day life when people ask you questions?
So I have to be honest with you, most of my patients trust me. That's why they keep coming back to me. So when I say to one of my patients and their families that I trust this vaccine, I've received this vaccine, my children and everybody in my family have been vaccinated, they tend to say, oh, well, that makes sense. Every now and then I'll hear somebody say, I have a question about, and something they read online, and I can get rid of that myth. But certainly we have to, as healthcare professionals, be the educators. We need to get out there and let people know vaccines are safe, they're appropriate, and if you haven't gotten your vaccine, this is the time to do it. Don't wait anymore. We know it's safe, millions of people have gotten it, and that's one of the best things you can do to stay healthy.
Yeah, we do know that there's overwhelming evidence to show that it is safe, but Kaiser Family Foundation surveyed parents, and 58% of them say they oppose mandating a COVID vaccine for kids entering school. So maybe that number will drastically change when you get that FDA full approval. But if it doesn't, what do you do with around 50% of parents that are saying, I don't want to vaccinate my kids?
Well, I'm not sure that 50% are saying I don't want to vaccinate my kids. The way I interpret this is I don't want to be told to vaccinate my children. But, you know, I often say, you know, we as a state have said you must use seatbelts. You must use bicycle helmets. So there is a public health issue here that isn't just about my decision for my child or for myself. There is a public health issue, and right now this is a public health crisis. So we need to get people to make the right decision and vaccinate their children of their own free will.
Right, it
and
affects
to
other
make
people,
sure that they get vaccinated as well.
Absolutely. You know, and it's interesting, just, you know, personally, I'm in a situation where we've got a 16-month-old daughter, and now I feel like my wife and I are going back into quarantine because we're both vaccinated, but we're afraid of bringing it home. I mean, what's the long-term horizon for, like, you know, really young children, vaccinations, all this sort of thing? It's just, I feel like personally it's very disheartening. We had a little moment of freedom in like June, July, and now I see it slipping away again.
Well, your point is very well taken. There's a reason I want to be vaccinated, not just for me, it's for my whole family, it's for my community, it's for everybody in New York City. And quite honestly, I was one of the first people to get vaccinated for my patients. I certainly didn't want to bring anything to my patients. So we've all have to be responsible.
Yeah.
All right, very good advice there. Thank you, Chair of New York State American Academy of Pediatrics and Coney Island Hospital, Dr. Warren Seigel. We're waiting for that FDA approval for these, younger kids. We'll see how that turns out.
Indeed. All right.
Thank you so much.
Yep, we appreciate it. Thanks, Doc.